select a vial of the prescribed drug from the dispensing system. Compare the name of the drug on the label of the vial with the name in the Medication Administration Record, or MAR. Check the expiration date and drug concentration or dose on the vial. Calculate the correct volume to withdraw. Double-check your work and, if necessary, ask another registered nurse to check your calculation. Check agency policy to note which high-alert medications require validation by a second RN. If the vial has not been opened, remove the cap to expose the rubber seal. Firmly wipe the surface of the rubber seal with an alcohol swab and let it dry. Select a syringe and attach a needle or needleless access device. If the syringe is capped, remove the cap first. A filter needle may be needed to withdraw certain medications from the vial. Review your agency's policy or the drug insert to determine if it's necessary to use a filter needle. This nurse is using a blunt tip needle to reduce the risk of needle stick injury. Then pull back the plunger and draw a quantity of air into the syringe equal to the volume of medication you intend to withdraw from the vial. Holding the vial on a flat surface, insert the tip of the needle or needleless device through the center of the rubber seal. Inject the air you drew into the syringe into the airspace of the vial. Press firmly on the plunger to overcome the air pressure within. Hold the vial with your non-dominant hand. Hold the syringe and plunger with your dominant hand. Invert the vial, securing the plunger to continue counteracting pressure within the vial. Keeping the tip of the needle or needleless device below the level of the fluid, let the air pressure in the vial slowly force medication into the syringe. You may pull back slightly on the plunger to hasten the process. When the level of medication in the syringe reaches the desired volume, position the tip of the needle or needleless device within the airspace of the vial. Tap the barrel of the syringe to dislodge any air bubbles. If air remains at the top of the syringe, eject it into the vial. Recheck the volume in the syringe. Finally, remove the needle or needleless device. Hold the syringe vertically, needle up at eye level. Make sure you have the correct volume and no air bubbles. Remove any remaining air by tapping the barrel to dislodge the bubbles. If air remains, draw back slightly on the plunger and push up to eject the air, taking care not to eject any fluid. Recheck the volume of the drug in the syringe. If you're using a needleless device or filter needle, replace it with a safety needle of the appropriate gauge and length before administering the medication to the patient.